One cracked tooth can lead to an infection that can spread.
Are you serious?
You are wondering how. Let me paint a scenario for you. Let's say, for example, you have a restless somebody, and then in the process, they fly off the table, they feel like they're Superman, and they hit their teeth on something. Boah! And the teeth becomes half, or it breaks, or cracks. Or you go and play football, and then in the process, you're trying to head the ball, and somebody uses their elbow, the hand of God, to give you boah, and the teeth becomes half. Or you are somewhere, and two people are fighting, and maybe you are the peacemaker. Blessed are the peacemakers. And in the process of dividing the fight, you get a boah, and the tooth becomes half. Those are different scenarios that could have happened. Or you are those people that I'm looking at in 5D. You're using your teeth to open drink, and in the process, the tooth breaks and it becomes half. That can also happen. But do you know that when the teeth cracks like that, you should actually do something about it? Some people have been moving around with their half teeth or cracked teeth for many years. Now it depends. If the crack is such that enamel, because I've always told you, teeth is in layers. The one that we see when we smile is enamel. The next layer underneath it is dentine. Now, dentine is very sensitive. And if you look at it, dentine has tiny holes through which infection can actually travel into a very delicate part of the tooth called the pulp, where the nerves and the blood vessels are. Now, once the infection gets here, you can end up having toothache, okay? You can end up having an abscess, collection of pus underneath the tooth. And so sometimes the tooth may even become longer than the other one that is not broken. Or some people may experience something like a small boil or pimple on your gum. As I'm talking now, lift up your lip. If you have a half tooth in front, you have a small boil or pimple there. You say, doctor, it comes, it goes, it comes, it goes, like pimples on your face. And then sometimes you may even have salty taste in your mouth. Those are just some of the things that could be happening. That tooth has actually become infected. And mind you, if you leave it, that abscess is destroying the bone around that tooth. And don't forget that you see this part of the face, the triangle of the face. It's a very dangerous point. Infection can easily track and spread.
Are you serious?
Yes, and it can become something more harmful. So if you have a cracked tooth, please don't leave it as that. Visit the dentist. The dentist will tell you more after a dental examination on what mode of treatment will be beneficial to you. Now, some people, as a result of trauma, maybe a blow or they fell, they hit the tooth, over time, not only is the tooth cracked or half, it now begins to become darker. You suddenly notice that that tooth that is half or is broken is now becoming darker than all the other teeth. Yes, that can also happen. You know why? Because more often than not, when you have a blow or you hit that tooth, or for those of you that have refused to listen, that are still opening your drink with your teeth, and the tooth breaks, remember that I said infection can travel through the dentine to the pulp, one, and cause infection of that pulp. And then the other thing that could happen is that because of the trauma or the force on the tooth that caused it to break, it can cut off the nerve and the blood supply that enters the tooth from the roots. And so the tooth is in your mouth. You may be thinking that all is well, but the tooth is actually dead. And how you know that the tooth is dead is that with time, just like I said, it begins to become darker than other teeth that are sitting beside it. In that case, it means that the pulp has become necrotic. In other words, the pulp have died. You understand that? And so that's what begins to make the tooth become darker. In a case like that, the treatment will be different. Please do not walk around like that thinking that nothing can be done. Something can be done. Please go ahead, see your dentist and have it treated ASAP. I remain yours, Dr. Joan Agbonikena. The dentist is your friend. Thank you.